From MMC Hospital, she is an obstetrician and a gynecologist, Dr. Kencana Shinta. Good morning, Doc. Thank you for joining us today.
Thank you. Thank you for having me.
So this is a topic that's a bit near and dear to our hearts. Can you first describe what is antenatal care? Because I'm not familiar. I have 3 kids myself. I'm not familiar with this term at all.
Okay. Antenatal care is the care from the healthcare professionals that you get during the pregnancy.
Okay.
And it's also to be called prenatal care or maternity care.
Okay.
And it covers several issues, just like promotion. Promotion is just how do you have to eat properly during pregnancy, about exercises, and then information about how to get the fund, preparation for the funding during pregnancy, and then the second is about the early detection and prompt treatment.
Okay.
So you will be checked about anemia, gestational diabetes. You will be checked as early as possible, so that if there is something wrong, then we can treat it as soon as possible. And then it covers also about emergency things, because sometimes it can happen during pregnancy, just like the common things are bleeding during pregnancy, and then hypertension, the preeclampsia, or contraction that leads to premature labor, something like that. And the last but not least is the inter-delivery spacing. So during the antenatal care, you will get the information about how to breastfeed the baby and how about the contraception that you should use after the delivery.
Right. This is something that I've experienced myself. Well, not me personally, but my wife, obviously. But we have 3 children. Our middle child, actually, when my wife was pregnant, did suffer from gestational diabetes. Now, she is not a diabetic, and gestational diabetes, to explain it a little bit for you guys that aren't familiar, is a diabetes that can happen throughout pregnancy only, which is very weird to me, because all of a sudden, my wife was very concerned. The doctor took blood tests and said, hey, you have diabetes, but this is gestational diabetes, which means there's a high chance that you may not have this anymore once you give birth. However, that created a lot of anxiety and stress throughout the pregnancy. We had to watch everything that she consumed. We had to take her glucose levels all the time, along with her blood pressure. So I guess I'm saying that every pregnancy has to be treated differently, because it could be the same person, the same couple. However, it can be totally different circumstances depending on the baby.
Yeah, I totally agree with you. Just like you don't have to be afraid because of the gestational diabetes. As soon as the blood glucose is controllable, it is okay. I mean, the most important thing is the blood sugar should be okay, because it should not be very high, or it should not be very low, because you also need all the nutrition for the baby to grow. Just like it is really important what you eat, because inside you have a baby inside you. Just like give the best for the baby. Just like if you build the house, of course you will choose the best material possible according to your budget. So, and this is for the house that you live in. This is for your baby, so give the best.
And we never would have known this without antenatal care, by the way, without going to the doctor regularly.
I just wanted to clarify again that this antenatal care is basically just a specialized medical care when a person is getting pregnant. So I want to clarify also what it's not. Is it including or not including like the usual checkups that usually mother would go to the doctor? The monthly checkup. Is it the same? How do you define it actually? Or is it just like more special care during the pregnancy?
Normally, the pregnant woman should have the antenatal care at least once a month until 28 weeks. And then after 28 weeks is twice a month, and then after 36 weeks is
every week.
Every week. Why like that? Because the complication of pregnancy usually happen near the delivery.
I see. All right.
So why do you think, we read some of those numbers earlier, why do you think not enough people get the proper antenatal care? Is it a lack of education? Is it a lack of finance? What is the problem?
Maybe first information, and then mostly it's information, because when you talk about funding, now we have all kind of facility from the top notch until the lower one. I mean, normally funding should not be an issue. We have BPJS. You can go to the midwives. It should not the issue. I think the issue is more the information.
People don't know enough.
Yes, the people doesn't get enough information why they have to do the antenatal care properly.
Now, usually the one that is in focus is the mother, right? Like you do all the checkup with the mother. However, I think pregnancy is a team's work as well.
Yes.
So what is the role of the partner during the antenatal care?
I pay the bills. That's
Not only that, Paul.
Not only that one,
course.
because during pregnancy, many things happen. I mean, pregnancy is such a, normally it's a beautiful time. You should be very happy, because not every woman can get pregnant, right?
That's right.
I see some patients that it's difficult to be pregnant. So it's such a blessing normally, and it requires a teamwork. It should not be handled alone, because pregnancy is just like a jet coaster. I mean, you are very happy that you will get the baby. At the other time, you are very anxious, excited. It's all at the same time. I mean, the support should be very, very strong. It's not only from your partner, from your family, from your mother. I mean, it's good that we live in a extended family in Indonesia.
Correct.
We have to make it
The most
the
out of
most directly. And then the partner or the husband or somebody else that is close to you, I think should be very much involved, because just like they should know, during pregnancy, the women can be very, just like sometimes sad, sometimes when I was pregnant, sometimes I was crying, and then why
am
I
I
was crying?
What are these?
It happens because of the hormonal changes.
Right.
And then, of course, your partner should know about it. So how can they handle it? And then sometimes also about the food. I mean, you have to take care of your baby, and sometimes the husband can helping also taking care.
cook for the wife, right?
When I asked the wife, how do you eat? It's good, doc, and it was what?
Yeah.
It
Right.
happens a lot, so it should be it's your child. It should be taken care of.
Yeah, I'll share a little bit from my experience when it comes to some of those things that you mentioned. For one, out of all our 3 kids, I think I've only missed one doctor visit because we would go every month and bi-weekly and then weekly at the end. And
Good for you.
That was because of a work emergency as well, Doc. But it's true because, and you have not yet experienced pregnancy, hopefully soon. But when you're experiencing pregnancy, and I put myself in my wife's shoes, and she has shared this with me at times after birth. Like throughout pregnancy, so many things go through your mind as a woman, and you feel like, so what if this goes wrong? What if this goes wrong? What is this now that I'm feeling? And then you have so much uncertainty that sometimes just being there actually helps. Like you don't have to do anything special. You don't have to, let me lift your feet. And just being there so you can have somebody to share
Like a
these
friend
feelings with.
also.
Yeah, and that's the support that I think that Doc is mentioning as well, that moral support.
Yeah.
It's understated how important it is to have somebody beside you during these times, because during these visits as well, not everything may go well all the time. For example, with my 3rd kid, I remember the doctor saying, your baby's a little bit undersized. And I think if you're alone, you might start to think all sorts of things. Am I not am I doing this? But I think just to have somebody there and say, okay, don't worry, we'll fix the problem and we'll try to get it up by next month.
I mean, that's early detection and prompt treatment. So if we know that something goes wrong, then we can fix it as soon as possible.
I actually have a question regarding what Paul just mentioned earlier, the mental side of the health.
Yes.
I understand that a lot of my friends who are pregnant, or even like my own mother, they usually have this kind of like prepartum, postpartum depression. Is it included in the antenatal care? And do you then connect them to the respective psychologist or like an expert to help them?
Yes, it happens. It can happen during the pregnancy, and the gradation is quite varies. Yeah, some people they experience it a little bit, but some people it's very not nice for them. So actually, it's something that can happen during pregnancy. First, you have to know that it's a normal thing, and then if you can embrace it, it's gonna be easier for you to take care of it. I mean, until now, I haven't had any patient that is needed to be referred to a psychiatrist or psychologist. It can be done within the family, and when I tell them that it is something that is normal, even since the early pregnancy, I tell them that such thing can happen. Also, after the birth of the baby, you have the postpartum blues. It is something that is quite often to happen, and then just like if you are prepared and you can embrace it, it's gonna be much easier. Just like if you want to travel to Europe, and you will find the information what is it the
logistic, where to stay,
where do you want to stay, how is the clothes. So it's not the weather is not the wrong thing, your clothes that you're not preparing. I mean, it's mostly like that. So
you can never be too prepared.
Yeah, you have to inform yourself. You have to get as much information as possible. And then if you have any doubt, just talk to your doctors. Now you have a lot of facilities with the internet or whatever, but try to get the good one. Internet is also, you can
all sort of things are there, right?
And then if you have any doubt or question, just ask your doctor.
Yeah, I think that's
write down. I mean, I always ask my patients to give a list, make a list, and then when they come to me, or they can always ask me.
Yeah, don't feel like any question is like, oh, is this silly if I ask my doctor? Just ask any question you want while you're there. Now, Rasha mentioned mental health, which is part of antenatal care. Physical, obviously, we've talked about is part of it. I've also read that social health is important for a mother during antenatal. What is social health, Doc?
Social health, just like you should have any involvement with the other person, just like especially the other pregnant woman. I mean, it's good to have a class or whatever, but it's much nicer if you learn it from your friends who experience the same thing.
Yeah, it's community learning.
Yes, so you have to keep yourself active and then go to your friends, and friends are much nicer. I mean, they will help you in whatever condition you have.
That's true, because there's always, like, let's say you have, again, gestational diabetes. When we shared this story, it ended up being like some family member or friend had a relative that had gone through it. And then it was a relief to hear, oh, you know what, my sister had that happen during her pregnancy, but afterwards she was okay, so you're likely going to be okay. Having those little kind of, anecdotes and experiences, it is very reassuring.
And also, I think it's a good way to crowdsource the experiences that they have in overcoming that, and not one is like a good solution for you, but if you hear from different sources, then you can calibrate that yourselves and try it yourself and find the right one for you, right?
Yeah, that's true. I had also gestational diabetes when I was in pregnancy. Yeah, it's okay.
Yeah, my wife was stressed out during the pregnancy, but again, like I would be too if suddenly I found out, because a doctor cannot make guarantees. They can only say it's most likely going to go away. But in your mind, you're like, what if it doesn't? So then obviously you're stressed out for that entire period.
I mean, as long as your blood sugar is controllable, it's okay.
Yeah.
I mean, you can.
Now, so many other things can go wrong as well, Doc. We mentioned, I want to go back to those numbers because those are still stuck in my head. So many during pregnancy or even throughout childbirth, so many lives are lost. How many of that do you think, is it a large number of that contributed to the lack of antenatal care?
Okay, 15% of the pregnancy, 85% of the pregnancy goes normally.
Okay.
Just like 15% you can end it up with the C-section or with
complications.
Assisted delivery, just like vacuum extraction or whatever. And 10% can, the bleeding during pregnancy can happen in 10% of the pregnancy.
That's pretty high.
So yeah, it is quite high. That's why we really have to prepare the pregnancy and then the childbirth itself. Just like we have to be sure that the hemoglobin level of the mother is good, because the chance of losing the blood is also quite high.
Right.
But as soon as everything is controllable, everything is on the right track, it should be okay, because pregnancy should be a very happy thing. You should be happy. It should be prepared very well.
Yeah.
I mean, and it's gonna be okay. I mean, it's a quadrat. What is quadrat? I mean, since the old time.
Yeah.
And now the possibilities, the choices, and the healthcare is much and much better.
More advanced as well.
Yeah, you don't have to be worried. You just inform yourself, prepare yourself, and then you just embrace it. Don't be too afraid during the childbirth or whatever. I mean, if you prepare for that, you do the relaxation, how to relax yourself, the good breathing technique, and how to calm down yourself. And then if you okay with if you are prepared, it's gonna be okay.
Yeah, it becomes more enjoyable.
I once read a quote: "The only way to live in the moment is to prepare for it."
Yes,
Yeah,
I
very good
truly
point.
agree with you. Don't be afraid of something that not yet happened.
True.
Yeah.
1 week.
Yeah.
In 1 week, what is going with my childbirth or whatever?
Yeah.
I mean, don't be worried with.
So I want to
go
go
ahead.
to the technicalities for someone that wants to do prepare for their pregnancy, wants to kickstart their antenatal care. Where should they go? Should they go to a specific hospital doctor, or they can just go to their general doctor and they will direct it to the right person?
Okay, you can go anywhere, just like you can go to the midwife, you can go to your GP, you can go to your specialist, go to health professionals that you trust and care. They can give you the antenatal care. And then, just like if you go to the midwives, and if you need more, what is it?
Support.
Or support, then they will refer you to the highest
Or a specialist.
But maybe your experience.
Well, actually, this leads me to my next question, Doc. How important is it? I'll tell you, we actually had an experience where we were living in a different city for our first child. And then we started visiting a doctor in Jakarta for a second child. And for that one, it took us, I think, 4 or 5 different change of doctors before we found one that was suitable. And this is something that I cannot explain because it's more for my wife. She was the one who made the final decision. But she says it's very important for a woman to find the right doctor because it's like, they say it's like cari jodoh. It's like, it's like cari jodoh. It's like finding the right partner in life. Like you have to find the right doctor. How important is it to make that connection between an expectant mother and the obstetrician or gynecologist that they are eventually going to be seeing from a month-to-month basis?
It is very important because it's a bonding, right? I mean, you have to find the doctors that you can trust, that you can rely on. I mean, it's a very big. It's your child. I mean, you should get the best for yourself and for your child, and find the right doctor for you.
What is that right doctor? Like, what does a woman look for when they're looking for that right doctor? What is that connection that they find? Obviously, trust is a big thing. But what is because you, I'm sure, have a lot of regular patients as well.
Yeah, the chemistry that, I mean, just like you can always just like ask your doctor anytime. And sometimes that you rely on, it's really a chemistry, I think.
Yeah. My wife says, I need one I can message anytime.
But that also shows commitment from the doctor, right?
Absolutely. And I'm sure that you have those patients that you have connections with that will not go to anyone else except for you, right?
Pretty sure.
Again, very important, guys. Antenatal care for all of you out there that are either family planning or you are expecting a baby. Make sure you get the proper care that you need. And if you do have any additional questions, please do check with your closest, nearest medical center or physician to try to find out more. In the meantime, thank you so much, Doc.
Thank you.
My pleasure.
Such a pleasure to talk about antenatal care. Now I'm very educated and informed.
Oh, I thought you were going to say I'm very excited to have a baby.
Well, that too, hopefully.
I'm happy to hear that.
Oh, there you go, Doc. Maybe you guys have made a connection.
You should prepare it before you get pregnant.
For sure, Doc.
Because you don't know when you're pregnant. Right?
Exactly.
The period is already 3-4 weeks.
Yes.
Never can be too prepared. We're going to take a short break here, guys, but in case you're just joining us, we're going to recap some of our earlier top stories from around the world when we return. The C Morning Show will be right back. Stay with us.